Arrived. Good morning, Dr. Ishwar. Good morning, Dr.
sir.
Ishwar.
Good morning, sir. Good morning, sir.
Good morning.
Good morning,
Yeah.
sir.
I hope you are done with your earlier meeting, sir. I heard
Yes,
that you are busy with WHO meeting.
it is continuing. I am because I was yesterday my talk was there, but it has been postponed it today. Just now,
Yeah, very nice. We're nice to
very
have.
nice.
I think we are ready to start.
Yes.
Good morning,
We'll
sir.
wait
Namaskar,
for a few
namaskar.
minutes.
Hari Om, Namaskar.
So the way forward we see for our Healthy Lifestyle Center program and physical education through that, it was provision of basic exercise equipment to the well-functioning HSCs.
Good morning, Dr. Nidhi.
Conduct refresher trainings for the trained staff again. And we have a plan to establish indoor.
Shall I speak without PowerPoint, or would you like to my PowerPoint and PC?
Staff to liaise with
Sir,
other.
what-
A very good morning to one and all present here. I, Shani, on behalf of Learnet, welcome you to the webinar on Indian specific guidelines for management of PCOS in association with Kasturba Health Society Medical Research Center. And Learnet is proud to be associated with Kasturba Health Society Medical Research Center as a digital partner for digital CMEs and webinars. Having said that, now I would like to play a short Learnet's video and would request everyone to please have a patient look. Thank you so much. Thank you so much for your patience. Now, without any delay, I would like to request Mrs. Shubhada Agasti ma'am to take over the session. Ma'am, over to you.
Thank you, Sonaki. Thank you very much. We are very thankful for your continuous support. Okay, thanks, Shobha. Okay, I am Shubhada Agashe, associated with KHS MRC as an Assistant Director, Clinical and Endocrine Laboratory. As you all know, KHS MRC stands for Kasturba Society's Medical Research Center, and our partner is ICMR's NIRRH. Today, it's an international webinar on intersystem dialogue. It's a fourth in series of our intersystem dialogues. Earlier, we had an opportunity to listen to yoga experts, homeopath experts, Siddha experts. These intersystem dialogues are primarily organized by both these institutes to address a very important and very burning issue of polycystic ovarian syndrome. We are in a process of formulating India-specific guidelines for management of polycystic ovarian syndrome. As you all know, it hampers women's life right from adolescence through reproductive age till menopause. We dedicate this webinar to a very famous Gujarati poet, philosopher, Dr. Sai Makran Dave. Now, Doctor, sorry, he was much above that. What he has said about yoga is yoga manifests in every life and illuminates wisdom, word, work. That is our oneness with Supreme. What a wonder of wonders. Thank you very much, Shobha, for sharing this slide. This is his centenary year. We are celebrating centenary year of Sri Makaran Mama as we all address him. And now we'll start with our inaugural session with Medha Suktam by our Assistant Academic Director, Dr. Shobha Iyer. Over to you, Shobha.
Om
एकदन्ताय विद्महे वक्रतुण्डाय धीमहि तन्नो दन्तिः प्रचोदयात्। यश्छन्दसा मृषभो विश्वरूपः छन्दोऽभ्योऽध्यमृतात् सम्बभूव समेन्द्रो मेधया स्पृणोतु अमृतस्य देवधारणो भूयासं शरीरं मे विचर्षणं जिह्वा मे मधुमत्तमा कर्णाभ्यां भूरिविश्रुवम् ब्रह्मण कोशोऽसि मेधया पिहितः श्रुतं मे गोपाय मेधा देवी जुषमाणा नागाद्विश्वाची भद्रा सुमनस्यमाना त्वया जुष्टा नृतमाना दुरुक्तान् बृहत्पदेम विदते सुवीराः त्वया जुष्ट ऋषिर्भवति देवि त्वया ब्रह्मा गतश्रीरुतत्वया त्वया जुष्टश्चित्रं विन्दते वसुसानु जुषस्व द्रविणो न मेधे मेधां म इन्द्रो दधातु मेधां देवी सरस्वती मेधा मे अश्विनावुभावा दत्तां पुष्करस्रजा अप्सरासु चया मेधा गन्धर्वेषु चयन्मनः दैवी मेधा सरस्वती सामा मेधा सुरभिर्जुषताग स्वाहा आमा मेधा सुरभिर्विश्वरूपा हिरण्यवर्णा जगती जगम्या ऊर्जस्वती पयसा पिन्वमाना सामा मेधा सुप्रतीका जुषन्तां मयि मेधां मयि प्रजां मयि अग्निस्तेजो दधातु मयि मेधां मयि प्रजां मयि इन्द्र इन्द्रियं दधातु मयि मेधां मयि प्रजां मयि सूर्यो भ्राजो दधातु हंस हंसाय विद्महे परमहंसाय धीमहि तन्नो हंसः प्रचोदयात्। ओम शांति शांति शांतिः। योगेन चित्तस्य पदेन वाचा मलं शरीरस्य च वैद्यकेन योपाकरोतं प्रवरं मुनीनां पतञ्जलिं प्राञ्जलि प्रणतोऽस्मि।
Thank you, Shobha. Thank you. It was wonderful. You have set the tone of our today's webinar. Thank you very much. Now for the formal welcome of all the participants. As I can say that there are already 73 participants have logged in. On behalf of faculties and students and postdoc students from KHS MRC and NIRH, it's my pleasure and privilege to welcome you all for today's international webinar on intersystem dialogue, perspective of yoga and naturopathy. Yoga, as you all know, is a discipline that focuses on harmonizing mind and body. It's an art and science of healthy living. And of course, you all are very much aware in PCOS girls, is this harmonizing is altered and they suffer a lot throughout their lifespan. And it's our endeavor to bring to a common consensus that how this polycystic ovarian syndrome can be diagnosed and treated, because we know that conventional medicine has their own treatment, but we have a tradition of uh, traditional medicines of which can be traced. As far as yoga is concerned, we can trace its origin to 505th or 6th BC, before Christ. This thing has started. So before taking much of your time, I hope our chairpersons are there. I would like and request to welcome our chairperson, Dr. Geeta Balsarkar. Geeta madam is there. As many of you must be knowing her very well, Dr. Geeta Balsarkar is DGO MBBS, MD OBGYN, DNB OBGYN. Madam works as a professor at GS Medical College and Nauroji Wadia Maternity Hospital. She's a clinical secretary of MOX, vice president of Menopause Society Mumbai branch, president of AMWI Mumbai branch, associate editor, Journal of OBGYN of India, Foxy Journal. Madam has over 18 years of teaching experience. She's actively working on a Foxy project on postpartum IUCD in India, undergoing training for the same, and also she is a faculty member of training program of many such programs. She is a recipient of prestigious Hargobind Foundation for the study of fetal medicine in 2008 at St. George Hospital, London. She is a chairperson of Young Talent Committee of Foxy and associate editor of the journal. I welcome Madam to take a chair. I hope Madam you are there. And our co-chairperson, Shobha. Co-chairperson for this inaugural session is Dr. Ashish Padke. He is MD Ayurveda, MD Psychology, MA Philosophy. He has done diploma in yoga. He is associated with KHS MRC as Honorary Deputy Director of Division of Endocrine and Metabolic Disorders, Lifestyle Module. Sir has been associated professor and ex-associate professor and head of Department of Dravya Guna for more than 10 years. He is associated with many organizations. Few of them are Somaya Sanskriti Pitham, Padma Sambhav Yoga Institute. He is a consultant in many national and multinational pharma companies for last more than 25 years. He is practicing yoga Panchakarma consultant, and he has many publications in national and international journals. He has presented papers in many countries. I request Fadke sir to take the co-chair. And with this, I hand over this platform to chair and co-chairperson for the further activities. Over to you, Ashish sir.
Yeah. Thanks a lot for very kind introduction. And I thank both the organization, KHS MRC as well as NIRH, for giving me opportunity to be with all of you and having this great experience. Can I have Dr. Balsekar madam?
Somebody could call, and if she's not there, go ahead.
We will continue.
We continue. We continue.
She's trying to log in, ma'am.
Okay.
So friends, we are actually going ahead with this very first inaugural session in which we will be having discussion on basic aspects about this PCOS and yoga. And we have got fantastic speakers to share their views with. We have got Dr. Vaidya, Ashok Vaidya and Dr. Rama Vaidya. Then none other than Dr. Ishwar Basavareddy sir from Morarji Desai National Institute of Yoga and Naturopathy, and Dr. Caroline from Australia. So I would, should we wait, madam, for Dr. Balsekar ma'am?
I think she'll join. We have very little time,
and
we want to do justice to everybody's talk.
Okay. So I would request I would like to introduce our first speaker in this particular program, that is Dr. Ashok Vaidya sir and Dr. Rama Vaidya madam. So I'm taking opportunity to introduce all of you our beloved Dr. Ashok Vaidya sir. He is MD in Internal Medicine and Therapeutics from GS Medical College, KM Hospital, Mumbai, and he has done his PhD in Clinical Pharmacology from Yale University. He is Professor Emeritus to KHS MRC, and he was former research director of our institute, that is KHS MRC. He is a visionary who has given a concept of reverse pharmacology Dr. Vaidya sir was a Merck International Fellow in Clinical Pharmacology at Yale University School of Medicine. Dr. Vaidya is an eminent clinical scientist dedicated to new drug development and scientific research for more than 3 decades. At SIBA Research Center for a quarter of century activity, he was actively involved for drug research, and he has been a consultant and expert to organizations like WHO, CSIR, ICMR, DBT, Ayush, and for the 11th and 12th 5 years plans of India. Sir is a visiting professor at Gujarat Cancer Research Institute, and he has been appointed as adjunct professor at Drexel University, USA. And our next speaker is, along with him, Dr. Rama Vaidya madam is also going to be there. Can I have her profile? Dr. Rama Vaidya ma'am is MD, DGO, DFP, and PhD in Applied Biology, Ford Foundation Fellow, Biomedicine, Yale University School of Medicine. She is Director, Division of Endocrine and Metabolic Disorder, KHS MRC. She is Research Director, Reproductive Medicine, BACS Hospital, Consulting Reproductive Endocrinologist, Vasudha Clinic, Santa Cruz. She has established fertilization in vivo model in rabbits for studying as a food as a focus on with a focus on
Sperm capacitation.
Yeah, one second. It is not there, ma'am. Can I get the slide, please? I'm not able to see the slide.
Yes, sir. Just 2 seconds, sir.
Brief introduction will be appropriate.
In the meanwhile, I would like to welcome Dr. Geeta. She has just joined.
Yeah. Great.
Welcome, Dr. Geeta.
Yes.
I request you to take the chair.
Can I have the slide of ma'am, please, so that I can complete that part?
I think if there is a delay, right away, straight away, Geeta, say a few words. Thank you, Dr. Phadke. Thank you very much for kind introduction. And I think we go ahead with the program, which is very important. And I was finding on the chat box that Dr. Nilima Kshisagar could not hear properly because of the low volume. How are you doing, Dr. Kshisagar? Nilima Ben? Hello? Yeah? Okay. So go ahead, please.
Yeah, Dr. Geeta ji, please have your remarks, opening remarks.
I think madam is busy in the hospital.
Okay.
We can proceed with ma'am. Okay, that's
Okay.
she's
So
busy.
let us start with the then first session by Dr. Vaidya sir and Dr. Rama Vaidya ma'am.
Okay. Thanks, Geeta, from a real yogic exercise that you are in action right away. And thanks for coming in. Yeah. Yeah. So shall I start with the
Before
permission of the
madam you
chair?
start,
Yeah.
I request all the participants and panelists to please keep your mics on mute, please.
Yeah. So good morning, respected chairpersons, Dr. Geeta and Dr. Phadke. And I'm extremely thankful for the organizing committee of this international webinar. When I say that, well, am I a part of it? I think most of the work has been done by the organizing committee, and none other than Dr. Ashish Phadke, who is an yoga expert, Dr. Satish Pathak sir from with his vast knowledge and experience from both conventional medicine and yoga. And so it's a great thing that this organizing committee has chosen us and given us this opportunity to speak on yoga. Is it a therapy or is it a lifestyle for PCOS? And before I speak of that, my thanks to also Dr. Caroline E. and Dr. Vibhuti and Subhada and Shobha Madam for taking up this responsibility of organizing an international webinar for India-specific guidelines. And is it that how the yoga and naturopathy has played a role for this area of looking into the PCOS? With that, those words and thanking, I would like to straightaway go to my talk. And many thanks to the co-author who is here, Dr. Shukvaidya, who has continuously guided me throughout life for how yoga has to be interwoven in daily life. So may I have the next slide, please? The next slide.
I want it done in the next half an hour. Tell her that.
Shobha, unmute. Shobha, mute yourself. Shobha, Dr. Shobha, madam. Yeah. Okay. So we know that there is a galloping prevalence of PCOS, and it's a major public health issue. But who is treating this heterogeneous disorder with a wide spectrum of clinical manifestations that you see on this carton? Dermatologists, gynecologists and reproductive endocrinologists, or medical endocrinologists, radiologists. Who is treating? Because it has a spectrum of clinical manifestations in each super specialty. And I would not go into the details. But most important, have we forgotten one area, and that is the psychological issues related to this? Is anxiety, depression, psychosexual, psychosocial, are these primary, are these secondary? This is a mute question, and maybe we'll be able to. And I also want to clear one part of my introduction. I was introduced as the first one to look into, yes, very early we have looked into, but I must thank who's another person who, Dr. Nidhi Chaudhary, who also did it in 2011. And in spite of her personal tragedy in the family, today she's with us. And Nidhi, many thanks for your presence here. Extremely thankful for that. Yeah, next slide, please. Now, very important, is inter-system dialogue really required? We think that it's a prerequisite to integrative healthcare. And if at all Government of India is thinking about one nation, one healthcare, then it is time, high time that we start an in-depth inter-system dialogues. And KHS, MRC, and ICMR and IRH. And I'm very thankful to Dr. Neelimakshi Sagar's presence because she's looking into some of the product development center and the entire area. She's a chairperson there. And she is also very carefully looking into that how PCOS can be and how we can develop India-specific guidelines. And we cannot forget the Ayush systems of medicine, and each one is also looking into the treatment of PCOS patients. And that Vanita Suri has very rightly expressed that. She's a part of the community medicine from PGI Chandigarh. In a very recent article in 2021, clause 1, she says that multiple healthcare agencies were consulted by 85.8% of the respondents. And what says that they were equally dissatisfied with all, including the conventional medicine. And we'll have to look into, Dr. Anushri Patil, we'll have to look into that. Why are they dissatisfied? And we have had the Intersystem Dialogue Series 1 was, convener was Dr. Nutan Nabar and Dr. Supriya Balera. And there are many Ayurvedic physicians who took part, including Dr. Tanuja Nesri. Then Dr. Survi Khemka and Dr. Anushri Patil had spearheaded the series 2, in that homeopathic experts gave it their views, and none other than the National Institute of Epidemiology, Dr. Manikam and Dr. Rajalakshmi convened this meeting for Siddha, and it was very much eye-opening how Siddha system of medicine is dealing with PCOS, and some of that was in depth. And today we have Subhada Agashe and Dr. Vibhuti Rao who have convened this, and thanks to both the conveners. And let's have the next slide, please. So really speaking, all the non-communicable diseases are low-grade systemic and chronic inflammatory diseases. And very nicely, Agar-G, in search of a germ theory equivalent for chronic disease, because we all know that germ and classical acute infectious response is like a classical inflammation. It is like a raging fire. And there, actually, through all the entire resolution that occurs because of the basal homeostasis, while in the case of these NCDs, which are low-grade systemic chronic inflammatory diseases, including PCOS, and we had asked this question very early because we came across in 1980s, really speaking, it was 86, that we had a patient of familial partial lipid dystrophy, the extended family of 167 that were traced, 30 were examined in details, and we found that it was an insulin resistance syndrome. As a part of the syndrome, one of the patients had a polycystic ovaries. But as it is said in Rotterdam definition, that it should be a diagnosis of exclusion. So, but that initiated us to look into the insulin hyperinsulinemia and insulin resistance. And then we finally, in 2003, in Indian Journal of Endocrine Metabolism, had given our first cohort of 90 patients where 75% had insulin resistance. As you can see in this cartoon, that Agar has given that insulin resistance and oxidative stress are the main reason for meta-inflammation. And it is like a smoldering fire, and it causes a chronic allostasis. And we have shown, we had also asked a question, and others have asked similarly, that is PCO a chronic inflammatory disease? We did find that there are HSCRP, TNF-alpha, IL-1 beta, IL-6, all these pro-inflammatory cytokines were increased in the patients of PCOS. We also found that when we had applied monitored medical nutrition therapy that had included yoga also as a part of the therapy, at that time, adiponectin had gone up, which is a cardioprotective, with the resolution of the chronic inflammation also. As we can see now in the next slide, that this chronic allostosis is like Hans-Sely did propose way back, and it is a dominant explanation framework for physiological regulation. But Peter Sterling has come up with allostasis, an alternative view of physiological regulation. What happens here is, as you can see in this cartoon, that the levels of stress mediators keep on fluctuating as the stress stimuli keep on occurring time and again, and it's a chronically repeated stress stimuli. With that, it mounts the levels of stress mediators keep going up and down and up and down, and finally, allostatic load increases to such an extent, and wear and tear of this chronic stimuli and chronic repeated stress stimuli, finally there is wear and tear, and it gives way, and a new set point of the homeostasis occurs. But sometimes it fails, it gives way. That's why in a very recent article also, the authors say stress reduction program should be included for early detection of the common psychological consequences of PCOS in adolescents, hopefully breaking the vicious cycle. And why the vicious cycle? Because there are also secondary stresses, also secondary causes for psychological anxiety and depression, like the cosmetic discomfort of hirsutism, acne, acanthosis nigricans, infertility, and so on and so forth. Next slide shows that does yoga reduce and resolve allostatic load and reinstate homeostasis? The studies that has evaluated changes in polycystic ovarian morphology, we did find also in our patient complete resolution of hepatomegaly as well as the polycystic ovary, and it had resumed but it was a lifestyle where yoga is just a part of it. Molecular signature of the immune response to yoga therapy in stress-related chronic diseases conditions and insight is a very good article. The same way, the meta-analysis of impact of yoga on inflammatory biomarkers, a systematic review, sorry, not meta-analysis. There were 15 articles that they have reviewed which finally they had chosen for many articles. And they have shown that HSCRP and IL-6 and TNF-alpha, these three that they had seen, that whether yoga was also associated with pranayam or associated with meditation, or it was only yoga asanas, still they found in all these articles that these pro-inflammatory cytokines had declined. Dr. Anushri Patil, who's here, had very nicely with us, has written yoga therapy as the fourth dimension in the multidisciplinary management of women with polycystic ovarian syndrome. And this should be given importance, where I think Dr. Satish Pathak is very, very close associate of us in this area of yoga therapy as the fourth dimension of multidisciplinary management of women with PCOS. Next slide, please. So Dr. Vaidya, the other day, when we were sitting and talking about it, synthesized the definition of yoga from Patanjali Yoga Sutra and Bhagavad Gita. Chitta vrittihi nirodhena samatvam prapnotiti. Samatvena sarva kriya karmeshu kaushalyam upalabhyate. Kaushalyena atma prabha pragna paramitaha prakatayati. And thanks to Dr. Chaya Godse's father, who's helped us in making this slide, one attains balance of mind and stillness of consciousness by the cessation of random thoughts. With such consciousness, one achieves excellence of skills in one's actions. Such an excellence brings glory and manifestation of intuitive intelligence. Next slide, please. The next. Yeah, I think it has been shown that PCOS, a large number of them, has hyperactive, and there is a definitely an imbalance of the vagal tone is poor. So in the autonomic nervous system, say this samatvena sarva kriya karmeshu kaushalyam upalabhyate, and with the excellent vagal tone, probably Arjun has shown a great kaushalya in this pattern that is self-explanatory. And there is a overexcitement. Siddhanti mama gatrani mukha parishusyati has happened again to the same person. So it can happen that the chronic allostatic load or acute allostatic load can occur in a situation and the battlefield where you are faced with difficult situations. Next slide, please. So a century of research in the science of yoga, 1921 to 2021. In the year 1921, Swami Kaulyanandji started research in physiological, psychological effects of yoga. He was inspired by Sri Madhavadas Ji, his yoga preceptor. Later, he established Kaivalya Dham for research in yoga. And it was a very interesting story that we got a chance to read. Mr. Behanan, a Yale PhD student, worked with the Swami Kaulyanandji. Experiments were for metabolism, blood pressure, and heart action in relation to pranayam. It was said that Kaulyanandji was invited at Yale University. He was to go there, but it was 1930s when it was very difficult because America was passing through a Great Depression and he could not avail of that opportunity, but he has contributed a lot to the research in the science of yoga. Next slide, please. Wonderful article. The day when we were planning this webinar, an international webinar, because Dr. Vibhuti was very much with us, and indirectly Dr. Caroline Eve was very much with us. And while we were talking, Dr. Vaidya just declared that I'm going to talk. And when he said I'm going to talk, I started looking into the genuine recent explanation on the aspects of yoga therapy, how it is perceived scientifically currently. And in a recent article, and I have loved reading this article, and one needs to read and reread and reread to understand completely, because the authors have taken such dedicated efforts to understand from it is really a convergent science, I would say. And in this, a model where a yoga foundational framework converges with current ideas in neurophysiology and biobehavioral regulation. Yoga therapy and polyvagal theory, the convergence of traditional wisdom and contemporary neuroscience for self-regulation and resilience, is a fantastic article. And this is an eye-opener. You can see almost a figure of an eye. And one side, it is a Purush, observer of the body, mind, environment. And on the other side, it is a Prakriti, Gunas, body, mind, environmental conditions, and also interactions. And there he talks about Sattvic, Rajasic, and Tamasic Prakriti. And in that, in order to achieve the self-actualization that is in the center, eudaimonia. This word is a very important word, that if we want to achieve this, then we have the sympathetic parasympathetic balance that we have created. And that balance remains, which, yes, goes up and down. And the sattva, and in that, it's very nicely ventral vagal complex has been explained. Today is not the time. I have only very few minutes left, perhaps. And Rajasic is with a sympathetic, and sympathetic overactivity has been shown in the patients with PCOS. It is probably an integral component, as much as you say that there is a chronic inflammation and there is insulin resistance, and that actually activates. So is it primary component? Is sympathetic overactivity is a primary component, and sympathetic parasympathetic imbalance, is it a nature of the, and we will have to look into that every time that we see any patient, we should do that. So with that, the next slide. The next, please, the last one. Sai Makrandave, a visionary poet prophet, and his birth century also. In order for us to accomplish this harmonious movement to understand cosmos, we have to do two things together. We have to calibrate our inner laboratories. I always say that always start any talk with Om, at least say Om. It is a question of collectively calibrating our inner selves so that we are mindful of what we talk to each other. It's a dialogue. And to study words of our great masters. One way would be to organize group meetings and invite the persons who have gone through experiments and experiences. This is an adventure in consciousness. This is a kind of awakening. Without pure awareness, we will be stuck in twilight region. What is called peak experience is always combined with love, compassion, friendliness, and goodwill towards others, to all. And so, with the IO systems of medicine and conventional systems of medicine, we all from biomedical field are dedicated to see that and have dialogues, and no cross-pathies is looked down upon, but try to understand. And with these words, this was my last slide. Thank you so much for patient listening.
Yes, Dr. Geeta, madam. May I have Dr. Geeta, ma'am? I'm really happy to have lecture of our ma'am, Dr. Rama madam, and Dr. Ashok Vaidya sir. And I would request to have next, sorry, is someone saying? Yes, Shobha?
Geeta is saying something. Dr.
Yeah,
Geeta?
please.
Ma'am, that was a very excellent lecture. And really, yoga is today the fourth dimension. Not only is it the fourth dimension, it's the most important dimension in today's life. And I'm very happy that you chose to speak on this particular topic today. You know, the country, as a country where we stand, and today yoga is really very important, not only in PCOS, it is just the beginning, but even in other ages of life.
Yeah. Thank you so much. Thanks for your presence. Thanks for your presence. And I may just say a few words about Dr. Geeta. When Dr. Geeta came to KHS MRC for one of the functions, she said, I'm a proud obstetrician, because today not many people wants to do obstetrics, but she does. She loves that. And she is a great teacher, very popular teacher. And thanks for your presence, Dr. Geeta.
Thank you, madam.
Shubhada.
Okay, sir. Will you be introducing Shobha, madam? Okay, I take this opportunity to introduce.
I don't think there is a need.
No, ma'am. I take this chance to introduce
Please.
you, Dr. Shobha Udupi. She has done her PhD in food and nutrition. She is a research director of KHS MRC, honorary director integrative nutrition and IOCutical, and former national president of Indian Dietetic Association. Shobha madam has done a PhD in food and nutrition from Purdue University in USA. She has worked extensively in community development programs for urban development and training as a part of government of Maharashtra. Principal investigator for 51 projects supported by Ministry of Health and Family Welfare as well as national agencies. Published nearly 80 papers in national and international journals, 7 chapters in books, 4 books, 2 manuals, 12 monographs published by Department of Food Science and Nutrition by SNDT University. She has guided over 14 PhD students and currently guiding 5 students. And still she is saying that there is no need to introduce. Ma'am, with this, I request you to introduce our guest of honor. Thank you.
It's indeed a great pleasure to welcome our guest of honor, Dr. Carolyn E. Dr. E, at the outset, may I express my great appreciation for consenting to spare your time and to associate with us, and to also that we have your colleague and younger colleague, Dr. Vibhuti Rao, who is this, and I would like to introduce you very briefly to our audience. Dr. E is a doctor. She has also done applied science and Chinese medicine, has also got her PhD degree. She is a senior research fellow of the JACA Foundation. She has many achievements and awards to her credit. She has been awarded the MRC Center for Research Excellence in Women's Health and Reproductive Life, a grant in 2021. She also has received grants from Cancer Australia for supporting people with cancer, and a grant for looking at traditional medicines from the Australian Traditional Medicine Society, as well as from the Cancer Council, New South Wales. I think with the person who has who is so well qualified and who has such extensive interest in women's health and in their reproductive life, as well as in traditional medicine, it is but natural that we would look to you for a very interesting and enlightening talk. And we also hope that we will continue our collaboration and relationship in the future for in the interest of women's health across the world. Thank you so much. And I now request you to speak, please. Thank you. My role is over.
Thank you very much, Dr. Udupi, and thank you so much to the KS MRC and the ICMR and IRRH for inviting me to this intersystem dialogue. I am truly really very honored and also really humbled to see, I guess, it's a really fantastic opportunity for me to see the true integration that can happen. It's just thrilling to see MDs and and obstetricians, really advocate for the important role of yoga. I'm so excited. I think we can really learn a lot from you in Australia. So I think I will take this back to my colleagues, to our research institute, because I think you are really doing some innovative work, and I commend all your efforts in this area. I would like to talk to you today to, I guess, provide you an evidence update for clinicians. I know that majority of people attending would be from the biomedical field, and this is taken from a talk that I gave to GPs. I was asked to present a talk on natural therapies for women's health, and also together with my colleagues at the Monash Centre for Health Research and Implementation, we've recently had a narrative review published that outlines a lot of the evidence that I will be presenting today. So I'm really happy to share that with the institutes when that is published. So I'm going to start with the role of probiotics, and I was really interested to hear Dr. Vaidya talk about, meta-inflammation. I completely agree. This is a very important concept in PCOS that we are only starting to address. Now, we know that women with PCOS have reduced gut microbiome diversity, and so this will actually increase the risk of systemic inflammation from the intestinal permeability. Now, a lot of this work is a little bit early, it's preliminary, but what we do know is that from a couple of meta-analyses is that probiotics can reduce some inflammatory markers and some metabolic markers as well. And they are also generally safe and widely available, although many RCTs did not actually report adverse events. And usually the adverse events are very minor, but I think if a woman has immunocompromised, then I would avoid prescribing probiotics just in case. Now, let's go on to thinking about micronutrients. So we know that women with PCOS are obviously more likely to be overweight and obese. That's very clear to all of us here, I think. And we also know that micronutrient deficiencies are very common in people who are living with obesity. This is partly due to a poorer diet, but also there are some physiological changes in obesity that cause sequestration of nutrients like vitamin D. So about 70% of women with PCOS will have a vitamin D deficiency, and there are also some other deficiencies like zinc, magnesium, folic acid, calcium, and vitamin B12. Now, as a clinician, it's my preference to always try and address the diet first to optimize nutrient intake. But let's have a look at some of the evidence around micronutrients and obesity. Now, there is some early evidence that women with PCOS may benefit from supplementation with magnesium and zinc and calcium, but you can see these RCTs are very small. And also we need to consider some of the potential side effects. So for example, high doses of vitamin E have been linked to increased mortality. Now, I think out of all the natural therapies for PCOS, inositol has the most evidence. So there have been several meta-analyses that suggest that it can improve insulin resistance compared to placebo, and it improves some of the glycemic markers as well. It may also help with reproductive outcomes. So it looks like it probably improves menstrual regularity, but there's not a lot of data around fertility. So there's just one small trial on pregnancy rates, and currently there are no studies that looked at live birth rates. However, when we compare inositol to metformin, it's as effective for insulin resistance, and it's also much safer. So as you all probably know, they are risks to using metformin. There's diarrhea, for example. Inositol is generally very, very well tolerated. It's also very low cost. It's a very cheap supplement. So that I think that increases, the access to inositol. Now, for other nutraceuticals, so again, going back to the concept of inflammation. So N-acetylcysteine, or NAC, is an antioxidant, and it can improve insulin secretion. And it's generally also very safe, so important to know as a clinician. It seems like it can have some metabolic and reproductive effects. So, for example, it reduced BMI and testosterone, but there was no difference for insulin levels, and it may also help with pregnancy and live birth rates, but it's not as effective as metformin for this. Now, and then there's some smaller trials for some other nutrients. So I think these are possibly beneficial. So vitamin D may improve insulin sensitivity. One trial of coenzyme Q10 also improved insulin sensitivity. And then a very small trial on melatonin suggested that sleep quality and anxiety, which as Dr. Vaidya highlighted is extremely important and I would say neglected in women with PCOS. So there are some nutraceuticals that don't seem to be beneficial and are possibly harmful, so I would avoid these. So chromium didn't seem to have much of an effect on insulin resistance, and it actually raises androgen levels. Resveratrol didn't make any difference to fertility rate in one small trial, and omega-3 fatty acid showed no difference compared to placebo for insulin resistance. Now, what about herbal medicine? So there's some early, I guess, preliminary evidence on some herbal medicines, and there's the most evidence probably for cinnamon, which has some effects on the metabolic markers, but unfortunately no effects on weight and BMI. There's been a couple of RCTs done on curcumin and on sage extract. And again, these would work as antioxidants and would work to reduce inflammation. Unfortunately, there's insufficient evidence currently to support the use of Chinese herbal medicine for fertility in women with PCOS. Okay, so I am a traditional Chinese medicine practitioner as well as a MBBS, and so my passion is on the use of acupuncture for PCOS. And I was also really excited that Dr. Vaidya talked about the importance of looking at sympathetic tone and the balance between parasympathetic and sympathetic nervous systems in women with PCOS. So certainly there has been quite fundamental research done that suggests that acupuncture may actually help by reducing sympathetic tone and increasing parasympathetic tone. So I think that's really, really interesting. There have been a lot of studies looking at fertility, and they show that there are improvements in menstrual regularity, but there are no improvements so far on pregnancy rates. And my team and I are currently working on a systematic review on weight loss. So looking specifically at women with PCOS who are living with overweight and obesity, so BMI over 25. And here we find that